going to spend some time talking to you about psychosocial adaptations. You need to refer to your maternal child nursing care textbook, and we'll be referencing several chapters throughout that textbook when you're getting ready to prepare for your exam. When you're thinking about psychosocial adaptations, it's important to review the principles of growth and development. They are going to be covering chapters 36 through 40 of your Women's Health and Child textbook. When you're thinking about categories of growth and development, you need to remember physical is going to encompass growth and changes in body tissue. You also need to think about social and emotional, such as personality, emotions and behavior, how we interact with others. As far as cognitive abilities, that's going to be sensory perception, processing, and utilizing information. Cognitive encompasses those thinking skills that are necessary for growth and development. Communication is obviously going to be related to speech, but you also need to consider articulation, voice, as well as fluency. Being able to adapt to independence and transition through normal growth and development is part of the idea behind adaptations of growth and development. Remember, human growth and development is organized and progressive, and typically it follows a very predictable sequence, but how each person transitions through those sequences is going to be very individualized. So the roles of the pediatric nurse we discussed a little bit in class, and we will talk a little bit more throughout the course of the next few slides. But the idea behind the role of the pediatric nurse is that we want to achieve optimal health. We want our clients to achieve optimal health. Our focus is going to be improve quality of health care for children. We want to focus on growth and development, health promotion, family-centered care, concepts by age groups, and then also being child advocates. When you are preparing to consider the roles of the pediatric nurse, it's going to require your attention to human experiences, how people respond to health, how people respond to illness, and then we need to include the integration of both subjective and objective data, as well as being able to apply evidence-based practice, and then show all of this in a very caring relationship that's going to facilitate health and healing. As far as being care provider, we discussed these as well. So remember the steps of your nursing process, developing or assessing your client, developing care plans. Think about those health screenings, monitoring growth and development, provide treatment and care, make referrals, and then evaluate the effects of the care, and then finally can make sure that you include documentation. We want to provide atraumatic care, and remember that a goal is going to be to first do no harm. As role as of teacher, with education, we can provide education directly. We can provide education in parenting classes. It's good to remember that being a teacher, there's going to be various levels. You may need to teach parents or the child directly, and consider the education of the parent as well as where that child is at in growth and development. So it's really good to have that base knowledge of growth and developmental levels. Remember the factors that are going to indicate readiness to learn. So you need to consider the developmental level, the language, the culture, previous experience, physical environment, and then your organization and skills. So being that teacher, how are your skills? We need to be able to anticipate guidance and support as well as counseling. As collaborator, we need to consider holistic care. We want to remember that the pediatric client comes with a family. So we're not only working with our one client, we also have to consider the family, and it's really important to maintain that family-centered care approach. As researchers, you are lifelong learners, so it's important to seek out new informations and apply new research findings into practice. When we do that, when we are these researchers, we are going to have better outcomes and increase patient satisfaction as well as patient care. Being a patient advocate is going to be part of the evaluation process. We want to create an environment of mutual respect and understanding for our patients and our families. And then care manager, you need to be able to delegate tasks. So delegate tasking to your nurses' aides, review that plan of care, watch for cost containment, and then collaborate. So talking to other team members, talking to that physical therapist, occupational therapist, physician, social workers. So being able to help with all of those avenues of our patients' care. When you think about the history of children in society, truly, it was survival of the fittest. The needs of children were secondary, and oftentimes they were looked at as mini adults. So oftentimes children received the same remedies as adults. So part of that being historically, we need to see where we're going and how future is changing. Society has made an investment in children, but it really didn't occur until the early 1900s, where we started seeing family-centered care in pediatrics. The family-centered care of pediatrics actually evolved when there was recognition that the emotional need of the hospitalized child were really unmet, and we were having poor outcomes. Really, in history, when you think back to Florence Nightingale, infectious diseases were rampant, and children often died. And if they had limited contact to visitors, they had the limited support. So the dramatic changes really came about in the 20th century, and parents and professors began working together, parents and professionals. Families have choices, they have input, they're respected, their decisions are considered. Nurses, we need to be able to communicate and teach effectively of all age groups. So not only our elderly and middle-aged, things like that, but we also need to consider our pediatric clients. If you look at how we continue to change, knowledge and technology continue to increase. We see wonderful advancements in medicine, and then we're also looking at federal programs. So thinking about the way the Health Care Act is going to change our cares. With current trends and issues, really to list these out, cost containment. We want to see a decreasing rate of underinsured children. We would like to see growth of health care assistance. We want to see decreasing patient base in hospitals, so we want to focus on home care, ambulatory care, declining the rate of childhood mortality and morbidity. We would like to see a decrease in poverty. We are seeing an escalating exposure to violence, so really protection, safety of our children is going to be a huge issue, as well as the growing cultural diversity that we are seeing. With the new shift in healthcare, you need to think about primary prevention, and some really big topics are, tobacco and risky sexual behaviors, alcohol and substance abuse, dietary and hygienic practices, lifestyle. We're seeing huge increase in the obesity rates of our children. So what can we as nurses do to shift from the treatment of disease to the promotion of good health practices? With the growth and development principles, this is going to be in chapter 33. And why is it important to know this stuff? Why do we continue to talk about it? Why do we continue to teach it? Because it's important to know what to expect at each stage. We want to be able to plan appropriate care. We need to understand why certain problems occur at different stages. And then we want to be able to teach parents and help them to understand behaviors of children at each level. So we really want to shift our focus to empowering parents. And have good, positive outcomes for their children. Terminology, terms you need to know. I would take a moment to look these up when you are getting ready to prepare for the exam. You need to understand the difference between growth and development, as well as the differences between maturation and learning. I would take a minute to think about some related terms, and they all are talking about developmental level, milestones, tasks, age, delay, arrest. So I would take a minute to look at this. Truly, all populations, regardless of race, ethnicity, gender, age, or social class, are at risk for impaired development. And our pediatric clients actually have the highest, are at highest risk. So our specific at-risk categories, if you're considering all of these terms that you see listed out up here, prenatal risks, birth risks, social risks, and then underlying health conditions and healthcare statuses. So chronic injuries, chronic illness, multiple or prolonged hospitalizations. All of those are going to put our pediatric clients at greater risk. So parameters of growth and development, or parameters of growth, really people grow in a very predictable manner. We talked about these in class when we broke out into our groups. And so I would pay attention to weight changes. Typically in that first 12 months, you can see weight tripling, and height will typically double by the end of that first year. The rule of thumb is a child's adult height can be estimated by their 2-year-old height times 2, if you want to take a look and think of it that way. Typically after 3 years we see about a 4 to 6 pound weight gain, and then we do see increasing weights during adolescence depending upon their lifestyle and activity level, and then around 8 to 15 years we see height increasing by about 2 inches. As far as head circumference, we're really going to pay attention to that when we have when we're looking at children, because head circumference does indicate brain growth. And then dentition, we see teeth erupting between 6 and 8 months. By age 2.5, they have 20 teeth, and then by around the age of 6, we see permanent teeth beginning to erupt. So we start seeing those baby teeth being lost, and then our permanent teeth erupting. As far as directional trends, we grow in a cephalocaudal direction, meaning so it's very predictable. Cephalocaudal meaning head to tail, so the head develops first. And when you think about newborns and the younger infants, we see that they have a very large head, and then the body tends to be a bit smaller in comparison. They will have structural control of the head before they have control of their trunk as well as extremities. And they also grow in proximal distal fashion, so nearest to far. When you think of midline to peripheral concept, shoulder control before mastery of the hands, and it should typically follow a bilateral course. When you're thinking about patterns, simple operations to more complex activities. So we're going to grow very simplified to more specific. We go simple to complex, so we are going to need to master new skills and master tasks before we are able to move on. So factors that can affect growth and development, different things that you could think of. There's lots and lots of different things. So genetics, the environment, culture, nutrition, health status, family members, parental attitudes, child rearing philosophies, socioeconomics, stress and coping, mass media. So there is, we have a wonderful opportunity for teaching when you consider all of the many things that can affect growth and development and how we can improve those. So by providing a lot of education to our parents, we can help kind of mold and help them grow and expand and be better parents so that we see more positive outcomes. So in class we talked about different age groups. We compared and talked about infants, toddlers and preschoolers, the school-age child, and the adolescents. So I would take a minute to pull those papers out and make sure that you have a good understanding of what those are and how they are different across the lifespan of the adolescent.